Hello, and thank you for joining me today for this presentation on healing, regeneration, and pain. This is video one of a two-part series, The Biology of Repair, Renewal, and Pain. My name is Lisa Schneck. I am a certified nutrition coach and fitness trainer. This presentation is for educational purposes only and does not constitute a replacement for medical diagnosis or medical care. And so, where we want to begin is with the understanding that regardless of your age, the body is always adapting and renewing. This is one of the most important insights in modern biology. Your body is not a fixed machine that is slowly wearing down. It is in a constant state of renewal, repairing and rebuilding at the cellular level every single day. And so this is quite a bit different from what we had believed for many, many years. For most of modern medical history, the body was understood like a machine. It grows, it reaches its peak, and then it gradually wears out. This wasn't an unreasonable conclusion. It matched exactly what doctors and patients could observe. So, what we observed was that physical decline seems to occur with age. So, performance, bone density, and healing, the speed of healing, this all visibly decreases over time. That reinforces this view of the human body as a machine that simply peaks and then atrophies or wears out. From there, we also see a prevalence of chronic disease increasing as a person ages. This pattern looks like this is inevitable wear and tear. And so that's the model, that is the model that we came to accept, which is that the body's a machine, it grows, it peaks, and then there is decline. However, there were quite a few discoveries over the past 70 years that really set that whole model on its head. I don't want to go into too much detail here. These are things that you can look into for yourself. If you want to, you can pause on the slide. Each of these findings didn't just add a new fact to what we understood. Rather, these discoveries fundamentally challenge the assumption of the body as a static structure that is just facing a slow decline. Together, they form the scientific backbone of modern regenerative thinking. So, first, we have neuroplasticity. The brain physically rewrites itself in response to learning, experience, and environment. New neural connections form throughout life. The fixed brain model, once gospel in neuroscience, has been thoroughly dismantled. So we know the brain changes. We know that it's going to change in line with its environment and the support that we provide it. Second, we learned about the glymphatic system. So during deep sleep, this is a very short window of time in your sleep. It's typically occurring predominantly when you fall asleep, you get through light sleep, you're going to go into deep sleep, and you'll cycle then for several hours between light and deep sleep. Over that period of time, you might, if you're lucky, you might have an hour of this very, very powerful sleep, this deep sleep. During this deep sleep, your brain tissue shrinks a little bit, and these channels open up alongside the vessels, and spinal fluid will come into the brain. It nourishes the brain. It washes out some of these metabolic byproducts. So when we talk about Alzheimer's, we will typically hear or be talking about amyloid plaques and tau tangles in the brain. This glymphatic system cleanses the brain of all of these different toxins, and it nourishes the brain. Understanding that was a huge thing. Third, we have autophagy, and this is just the ability of the cell to recycle its own dysfunctional components and then use those again. So the cells are essentially kind of cleaning themselves up, and they find this happens in response to what we call hormetic practices. Now, we've talked about hormetic practices quite a lot over this last year. Examples are fasting, intense exercise, or well, I already said intermittent fasting. We also see this with things like cold plunges and um, even microneedling. That's hormesis, and hormesis leads us to autophagy. Mitochondrial adaptation. This was something else that we've just learned in the last 70 years. Mitochondria, the cell's energy producers. Again, over the past year, we've talked about these a lot. We know that they can multiply, they can improve in efficiency and in response to aerobic exercise and metabolic stress. The body literally builds more power infrastructure when challenged appropriately. And that's again talking about that hormesis. And finally, here, hormesis, low doses of stress, exercise, cold, heat, fasting, these activate protective and adaptive responses that make the whole system stronger. It's dose dependent. The relationship isn't linear. More is not better. So, what you're essentially doing is you're introducing a stressor that you would not be able to tolerate for very long. You're introducing it for a set small period of time. You're removing it. The body has this reaction, and that reaction is incredibly good for you. The body, as we've come to learn, is not passively declining. It is constantly responding to inputs. Our job is to provide the support required for these systems to function as well as possible. So we just want to look little bit more at some of the amazing things that our human body is doing. Now, as we age, we do know that the trend is toward slower healing. We also know that none of us are getting out of here alive. We are going to experience decline. However, the amount of decline that the average person experiences and how rapidly it occurs and how little of their strength and their balance and their cognitive faculties they're preserving throughout time, that's the problem. See, we have control over these powerful influences. So the body is not waiting to heal. It is healing right now, each moment. Billions of cells are being replaced, repaired, or renewed. 330 billion cells replaced every day, about 1% of all the cells in the body. Continuous renewal. As I'm sitting here talking to you, it's occurring within me. It's occurring within you. We have this process of breakdown and a process of rebuilding that are happening at the exact same time. So, our digestive tract lining renews every 3 to 5 days. Our skin cells renew every 2 to 4 weeks. Red blood cells replaced every 120 days. Muscle rebuilds and strengthens at any age with resistance training. And our bone is continuously remodeling and renewing throughout life. Aging slows these processes, but it does not stop them. The body's regenerative capacity remains active through life, but we have to support it. Your body is working to heal right now. Our job is to support it. So we're going to look at the 3 phases of tissue healing. So let's say you have a trauma, or say micro trauma, not a major trauma. You have a cut, right? Or maybe you've worked out and you have breakdown in your muscle, right? You've got the first thing you're going to experience is inflammation. This is blood and immune cells arriving on the site. This happens within 0 to 3 days. This is your first stage. So you're going to you might feel heat, it might be red, it might be swollen, perfectly natural, nothing wrong with it. Step number 2, new tissue is laid down. Now here you're still going to have swelling. This repair phase can last from 3 days to 21 days. From there, we move into the remodeling phase. It's in the remodeling phase that the tissue is strengthened and it is reorganized into what it needs to be. So, for example, with your muscle, let's say we've broke down the tissue, we've caused inflammation. We've rested just a little bit there in the beginning. We've made sure to put in the right nutrition and maybe some stretching. So now the new tissue is laid down. Now it's time for remodeling. And when we remodel, We have to be moving the body through the range of motion it needs. We need to be using that muscle in the way that we intend to use it so that it remodels along those same lines. And now let's take a look at what pain really is. It is one of the most misunderstood signals in the body, and we're going to change that today. You can think of pain as your alarm system. Consider a smoke alarm. It goes off when there's smoke, right? So you could have a fire in the kitchen and thank God you've got that alarm because it's going to go off. It's going to wake everybody in the house. It's going to wake everybody around the neighborhood. But sometimes there's not a fire. Someone's just burnt toast, right? That alarm doesn't sound any less shrill depending upon what has set it off. And that's very much, it's a really good way to look at pain because that's what pain is. Pain is a communication to you, right? It's a warning signal. Something is wrong. And so what we expect, what we think is that the level of the pain should match the level of the hazard, right? We don't need our pain to be dialed up to an ear splitting shriek in order for us to interpret, okay, something's wrong here. But that is what can happen with us, even when the pain signal is not proportional to the actual damage. There are other factors that contribute to how loud that alarm is. And those three systems that create your perception of pain. We have the mechanical systems, which just absolutely make sense, right? That's the physical, mechanical structures that we're talking about, the joints, the muscles, the movement, the patterns. It's how that mechanical system is happening. But if you look there are two other systems influencing how loud that pain signal is. The second one is your metabolic system. So if you are inflamed, if your blood sugar is high, if your nutrition is poor, if your hydration is low, if your gut health is poor, then your system, your central nervous system, will interpret those mechanical aspects with a heightened sense of urgency. So whereas you may have something mechanically occurring, that metabolic system, when thrown out of whack, is going to amplify the pain you actually feel. So it's not that you're imagining the pain, it's that the metabolic system, being inflamed, having a high blood sugar, being essentially unhealthy, magnifies. It's like a megaphone for the pain signal. And then in addition to that, you have the nervous system. So this is where we get the sensitivity, the stress response, the sleep quality, the emotional state, and the past experiences. So your nervous system is very much a part, it's a huge part of what you feel as your pain signal. And so the point behind this is that pain is not always and is never exclusively about damage. It is often protective and it is amplified by high inflammation, high blood sugar, and past experiences, what your nervous system has become accustomed to. So, a person, for example, with post traumatic stress disorder, this person will almost undoubtedly have a higher incidence of pain, a more intense pain because their nervous system is keyed up. So we're going to start with metabolic health. Metabolic health determines how efficiently the body produces energy, regulates inflammation, and repairs its tissue. Nearly 88% of adults in the United States show some degree of metabolic dysfunction, including insulin resistance or impaired glucose control. So when the blood sugar is poorly controlled, blood sugar spikes increase your inflammatory signaling throughout the body. This directly amplifies pain. So we have increased inflammation from the excess blood sugar. We have damaged circulation. So high glucose damages your small blood vessels, reduces oxygen and nutrient delivery to the tissues that we're healing. And we also then have heightened nerve sensitivity. So metabolic stress increases nerve irritability, amplifying pain signals throughout the body. And then further, cells that are under metabolic stress have less energy available to them for regeneration and recovery. So the very cause of the inflammation remains unresolved because the healing is not supported and the pain is going to continue to increase in that way. Second, we have the inflammation, friend first, problem later. So, short term, we know inflammation is essential. Acute inflammation is the body's first responder, clearing debris and beginning repair. Without it, healing cannot start. The problem is whenever it becomes long term. So, when the inflammation persists for weeks and months, it damages healthy tissue and it disrupts the very recovery signals that we need to end it. Lifestyle is the lever. Diet, movement, sleep, stress management, these are the most powerful tools for regulating inflammation. And then third, we look at the nervous system sensitivity. Chronic stress interferes with repair. Elevated cortisol, so you being chronically stressed out, will suppress your immune function, disrupt your sleep, increase inflammation, and amplify those pain signals. Healing improves when the nervous system shifts into rest and repair mode. We've talked about this before. You cannot be in a state of rest and repair while you are in an activated state. The two do not occur at the same time. So we want to be sure that we learn how to rest to enter a peaceful state. Next, we're going to look at the pain protection loop. And this is the cycle where a pain leads to reduced movement. This weakens the body. It leads to more pain, and the cycle continues. For some of us, it continues till we can't get out of a chair anymore. So we have to interrupt this cycle. But essentially, we have the pain, we reduce our movement, our muscles weaken, our joints become less stable. Now we're going to get a strain on the tissue, both the weak muscle and the connective tissue of the joints. And that's going to cause more pain, which is going to cause more reduced movement, which is going to cause more muscle weakening. And so what we want to understand here, we want to move the body. Even when you are in pain, obviously you have to go. You have to have the pain checked out. You have to get clearance from a doctor. You don't want to be silly here. You want to be sure that if there is pain, you understand what's causing it, and a healthcare professional has told you what you should do about it. But from there, we have to move. So there are plenty of examples of pain signaling without damage. Pain can exist without structural injury. So recognizing these patterns is empowering. It means we have more options than we think. So we have post-exercise soreness. This is muscle soreness after exercise. It's caused by temporary inflammation, microscopic repair processes. It's a normal part of strengthening the tissue. We can have morning stiffness. So overnight, as you're laying in bed and you're laying horizontal, your circulation slows, your joints are remaining still. When you wake up, you can feel a little stiff, a little bit of movement, and especially if you intentionally move your joints through their range of motion, that gets the synovial fluid inside the joint capsule moving around, gets your circulation moving, and you'll feel better. Interestingly, and we're going to talk about this more in the next slide, chronic back pain is it's kind of wild. Research shows that many people with chronic back pain have completely normal imaging results, meaning there's nothing mechanical that can be seen as being the source of this pain that these folks are being debilitated by. So pain often reflects nervous system sensitivity rather than structural damage. No less debilitating, no less real, but we can do a lot more about that. And then we have our stress amplified pain. So psychological stress increases nervous system alertness, and this is going to amplify pain signals even when the tissues are healthy. So why does this pain persist? The pain often lasts not because the body cannot heal, but because the healing environment is incomplete. So we have mechanical damage in many cases, and it's not healing because the environment is not right. Something's missing. And so this could be because of chronic inflammation. Low grade inflammation keeps the nervous system in a threat ready state. And now that's exasperating other factors. Poor circulation. So our tissues rely on blood flow to deliver oxygen and remove inflammatory waste products. But if we're not moving, our circulation's moving poorly. And then, of course, there can be health related conditions to do with your poor circulation as well. You could have malfunctioning valves in the veins. You could have, a lot of other things can contribute to this, but the pain persisting, chronic inflammation, poor circulation, and number 3, underloaded tissues. So muscles, tendons, and bones, they weaken without regular use. It is use it or lose it. And this makes everyday movements more stressful. So by intentionally loading the tissues, and again, doesn't have to be an hour or two. There are very wonderful, joyful ways to force your body to adapt, right? To trigger an adaptation in your body. It just doesn't have to be that tough. We're human beings. We have physical bodies. They are amazing, but we have to challenge them to adapt. And then poor sleep. Research shows people sleeping less than 6 hours per night experience significantly higher pain sensitivity. And finally, metabolic dysfunction. Elevated blood sugar damages nerves and circulation. This increases pain signals. So by the numbers, 65% of people with chronic back pain show normal results on their scans. 65%. 25 to 30% sensitivity increase for those who have sleep deprivation. So, meaning your pain sensitivity increases 25 to 30% when you have been significantly deprived of sleep. And you also are going to have a higher insulin resistance associated with increased rates of nerve pain and inflammation, and of course, weight gain, and a whole lot of other things. So, what can we do in the case of tissue that's been broken down and now needs to repair? So let's say there was an injury to the lower leg. I'm not even going to say where. There's an injury to the lower leg, and we need to support that injury in healing. Well, we're going to get the right nutrition. We're going to get the right sleep and rest. We'll talk about those in video number 2. But one of the most important things that we're going to do is what's called graded activity. So if you've ever been in physical rehab, then they've probably presented you with graded activity. And what this means is that we introduce just a little bit of movement along the lines of whatever it is that the person needs. And then we're going to build on that slowly over time. And the reason this works is it slowly rebuilds the tissue strength. So your muscles and tendons and bones, they begin adapting, and they're being gently loaded. We're not asking too much of them, but we're progressively asking just a little bit more. Very importantly, it retrains the nervous system. So when you're moving, you're teaching the brain that the body is safe again. I've talked about this before in other videos, but your range of motion. So for example, if you're doing just an arm circle, well, if you don't typically do arm circles and you go to do one, you'll notice that you have a decreased range of motion from what a person who does them all the time might do. And that might tempt you to say, oh, I'm getting old. Oh, I've got some kind of an injury. Oh, all the different things that one might think. And really all it comes down to is your nervous system. Again, it's only going to let you get the range of motion that it is sure you are safe at. And that's going to be what you consistently ask to be able to do. And so in performing these movements and in slowly over time pushing your range of motion and so forth, you're retraining your nervous system to realize that it is safe, and this helps deaden that pain signal, among many other things. And of course, with the graded activity, you're also getting improved circulation. So blood flow is delivering oxygen and nutrients needed for repair. It's also removing some of the byproducts of just cellular, functioning. And fourth, it restores confidence. The brain becomes less protective when movement is successful, and we also become more confident when our movement has been successful. And so the way that the system's going to operate ideally is that you have the stress or you have the injury, one or the other. An injury is a form of stress. And then you allow it to recover. And then from there, you get adaptation. So in the case of a rehab situation, you've had the injury, and now we're getting the adaptation. So that might be the exercise that we're going to do, right? It could be many things. But you're going to have the rest and the recovery in between. You apply the stress. You have to rest and recover. So that could be the sleep that you need at night. It's the nutrients that you need. So if you're not consuming the amino acids and protein, you're not going to build more muscle. You may not even keep the muscle that you have. So we have to put the nutrition in that the body needs in order to repair these tissues. We also have to sleep and rest. And then from there, we get the adaptation. Now, when we are intentionally programming for ourselves, so let's say you're out of rehab now, and your injury is still causing you issues. And so now you're beginning to take the path that I'm suggesting that you take, which is to not just get out of rehab and then go sit down somewhere. You want to continue stressing and adapting, stressing and recovering, leading to that adaptation that you need, which is going to lead you to being in the best health you can possibly be in. And we get that through this sort of hormetic process. So if you're in the gym or in the classroom and you're breaking down those muscles, then you have to rest and recover from that. We don't want you doing too much. And then you get your adaptation from there, which is both central nervous system and muscle and balance and all of these different components. So without challenge, the body does not adapt. With the right challenge, the body can heal. And so in either situation, whether you're coming from, you've been injured and now you are recovering from the injury and you want the pain to go away, or if you've just never been in very good physical health and you're beginning to have that sort of descent into poor health, and you want to walk that in the other direction, it's the same process. So when we're talking about hormesis, which is what we're talking about here, we're using stress to heal. Not all stress is harmful. The right kind of stress, applied in the right dose, activates the body's most powerful healing pathways. So we introduce the intense stressor. We remove the stressor. There is a heightened systemic repair. Cellular repair pathways activate. You're rebuilding stronger than ever. Then we have the rest and recovery. The body is consolidating gains and returns to a new elevated baseline. And then we have the adaptation. You emerge more resilient, capable, protected, and ready for the next cycle. Hormesis is the biological phenomenon where a low dose of stressor that would be harmful in large amounts actually is the mechanism through which we stimulate repair, adaptation, and growth. And so we have 5 powerful examples of hormetic stress. Exercise is one, the sauna, cold exposure, time-restricted eating, and the phytonutrients in various plants. These are excellent ways of getting that sort of challenge to the system. With the right challenge, consistent, measured, intentional, the body heals and it grows. Hormetic stress is not something to fear. It is something to prescribe. So a better way to think about pain and healing. Is understanding that pain more accurately is the first step toward recovering more effectively. So the traditional view, pain equals damage. You focus on one body part, so treatment targets a specific area right where the pain is felt. We rest and we avoid movement, and we think of healing as just passive. It's just happening to us. We can just wait for it to pass, and when we're healed, the more accurate view is that pain is a protective signal. Pain reflects the brain's assessment of threat, not just tissue damage. Multiple systems are involved: the nervous system, the emotions, sleep, the environment, they're all playing a role. Movement supports recovery. Gentle, purposeful movement helps retrain the body and reduce sensitivity. And finally, healing is an active process. You are a participant in your recovery, not just a bystander. And so the 5 systems that influence healing, I like to call these the 5 wellness superpowers. I talk about them constantly. Nutrition. We have to fuel our tissue repair and regulate inflammation through excellent nutrition, nutrient dense, low calorie foods, through our mindset, which does shape our pain perception and recovery outcomes, through connection, through sleep, and through movement. And so, in our next video number 2 of the series, Healing, Regeneration, and Pain, I will go into more depth on how you can use those 5 wellness superpowers to speak to healing, regeneration, and pain. Thank you so much for joining me. Have a wonderful day.